As of recent, I've been reading quite a bit on manual therapy. Last time was a cat, by the way. We went with a frog this time because they're cute too. Even the big one, especially the big ones. Many of these comments, more specifically on social media, are saying that manual therapy is a neurologic effect only, as in a change in the sensitivity of the nerves as opposed to a tissue changing effect. And it's being said for a good reason. There are studies that are showing clear nervous system results when manual therapy is done, which is nice. Frankly, the osteopaths have been saying that for, I don't know, about 100 years plus at this point. But just ignore the osteopaths. That's what they're used to. We wouldn't want to make them feel uncomfortable. I have my opinions as to what else could be affected with manual therapy, but we're holding off on that for this one. More on that another time, I'm sure. More specifically, with manual therapy, what we can say that neurologically occurs, or what manual therapy affects, we get pain threshold changes. That's the amount of stimulus it takes to evoke pain or create pain. How many times you have to poke something to make it hurt, basically. Therefore, we also get increased pain tolerance. So as the pain threshold changes, the tolerance can go up or down. We also get excitability of motor neurons. And if we have too high a sensitivity in those motor neurons, for instance, in the afferent side, resulting in an efferent, it means extra contraction when there should not be. We also get thermal pain sensation changes, and that's sensitivity to hot or cold. So as these things come together, if you change them with manual therapy, this can be a benefit because it decreases the sensation of pain on a bunch of different levels, and it changes the reactivity to that pain. I want to point out, though, these studies I've read so far seem to be based pretty much on the application of HVLA, that's high velocity, low amplitude, or HVT. Depending on where you are in the world, it's called one or the other. So HVT being high velocity thrust. Generally we associate this with cracking and chiropractic, but of course physiotherapists do that as well, and a few other fields depending on where you are in the world. But these studies typically are done by physiotherapists that show this information. So this is great. All of this is amazing, actually, that they could figure this out at all. Very happy to see well-conducted research with reproducible results that is actually applicable in a clinical environment. You can use it, in your work. It's not just study-only stuff. It's not just an interesting point. It's useful information. Now, say for some reason, though, this neurologic effect or influence seems to be stated as a negative on social media. At least I've seen that the case, as a negative, something to the effect of manual therapy is only a neurologic effect. To which I would say, is that not even better? Isn't that even better? If you're being told that the way in which you move the body has even the slightest impact on some of the highest levels of control of physiologic expression in the human body, I would consider that a positive. Back to those osteopaths for a second. Again, don't tell them I said this. To add this, it seems they've shown through peer-reviewed journals that their form of hands-on therapy, called osteopathy, I think, there is an effect on the ANS, or autonomic nervous system. And that's inclusive of the parasympathetic, but mainly what is looked at is the sympathetic nervous system. That SNS, sympathetic nervous system, is associated with fight or flight generally. That's kind of like the layman's terms for it. But more importantly, what it actually does is regulation of blood flow and glandular secretions in the body. So it helps regulate a lot of our organs, and tissues, and systems in many ways. It helps coordinate it. And it's very essential that we have a sympathetic nervous system. It's kind of vilified in a weird way sometimes, but it's essential to life, so you kind of need it. So in short, sympathetic overactivation, usually due to stress, is associated with chronic stress, overactivation of the sympathetic nervous system, generally a bad thing, chronic stress. And chronic stress itself is associated with poor health outcomes, keeping it very general here. By the way, I need to mention, these peer-reviewed studies done by osteopaths, those are doctors of osteopathy, these are American doctors of osteopathy, by the way, They are from the American Osteopathic Association, which is their journal. Please look it up. They have everything available in full, even the back issues, super easy to access. It's worth a read if you're interested in this particular field. The main points we can look at are heart rate variability and cortisol levels in saliva, basically marks for sympathetic effects. The cortisol ones really, really neat because they're tracking how much is released, say, before and after application, and shortly after, maybe a day or two. But it's looking at how stress is monitored in the body and how stress can be reduced through those markers. And so what is found generally is that the treatment the osteopaths do can reliably reduce sympathetic stimulation and or expression. Those are very much, two parts of the same side. This is good because our sympathetic nervous system is part of what controls, for instance, if I'm being more specific here, blood flow to the gut, the amount of blood flow going to your digestive organs, and therefore it has an influence on digestion. It's not the sole control, but it's part of it. It's also part of what controls the heart rate and the contractility. So that's the speed at which your heart contracts and the amount of force behind that contraction. And so this would influence our cardiovascular system as a whole. As well, it actually turns out the sympathetic nervous system is what controls part of the blood flow to the brain. And now it's a small change it can make, but it's a significant change. When we're under stress, I always found this fascinating. When we're under stress, you tend to get a little bit less blood flow to the higher centers of the brain, your rational cognitive thought, and you get more blood flow, slight, but more blood flow to the lower centers of the brain. Not nearly as rational, more animal, if you will. And this last point, though it's newer in the research world, there would appear to actually be a relation with the inflammatory pathways, or even a separate inflammatory pathway, and the autonomic nervous system. The parasympathetics having one effect, and the sympathetics having another effect. And these are independent of the normal inflammatory pathway. It's new, but still really neat. And so, therefore, also has an influence on the immune system. So if osteopathic treatment methods can help these work better, these systems work better, they should help the whole body work better. And it actually tends to be that osteopaths, that are trained in this way, and it is a very specific way of training, osteopaths work with sicker, more diseased patients. Generally, body pains, for instance, is not what you find in many of the studies that they write up in their journal articles. Not that those aren't completely worthwhile things to study. They are. Pain is a fascinating subject and needs to be much better developed. And it is, thankfully, getting some attention nowadays. But I'm sure this focus on disease, this management of disease, changes the findings and goals in a significant way when it comes to this type of hands-on therapy. Now, I want to be very clear on this. I'm not saying biomechanics are the cause of a disease or any disease. I really can't say that. I'm saying that this form of hands-on therapy has been found to improve management of conditions and diseases, often alongside a typical medical treatment. As well, it's versus or compared to exercise-based therapies, and oftentimes showing that it has its own effects separate of the exercise, sometimes better than or equal to, but oftentimes synergistic with an exercise routine when it's possible. Again, depends on the severity of the disease. You don't want to exercise in every single case. I need to point out, though, osteos tend to use a lot more manual methods than just the HVLA, that high velocity, low amplitude thrust, or just the high velocity thrust. In fact, it tends to be only one small part of their process. There's an entire component of their treatment application that is very much the opposite of the HVT. Very, very different. And we might call this a method indirect or balance. It has a few different names that some of you may have heard before. Let's say counterstrain would be a good example of it. But the goal, the difference is neural reactivity reduction by position and by movement. That's a shortened way of explaining it. But by moving the body, changing the position of the body, we can reduce the reactivity and the firing off of nerves. As well, there tends to be in that osteopathic treatment large rhythmic movements that they claim assist in fluid movement. To be determined. The research is there, it's just not fully done yet. So I'm not gonna weigh in one side or the other just yet. These methods tend to take more time, though, and they require slow, consistent movement as compared to HVLA, HVT, which is typically like a short, fast, singular thrusting application. But this difference between the two might actually be what is affecting the autonomic nervous system, what gives it the ability to do that, where we don't typically see it in pure spinal manipulation. So I'll just say that even if it just were that manual therapy was a neurologic effect only, that's pretty good, right? Like that's pretty good. That's really good, I would think. There's definitely more work to be done on refining these ideas and the process by which they're best achieved. That has to be worked out. Certainly new information is improving our understanding of the body and how it changes due to manual applications, but I don't personally feel this as a negative, and the full story is far from being told.